Good morning, everyone. Thank you so much for, I want to thank the sponsors of this event for putting it on and for staying home from your home districts in Boise and for inviting us to talk about this, because this is probably the most important issue facing anybody in Idaho right now, whether they know that or not. My name is Jim Baugh. I'm the Executive Director of Disability Rights Idaho. We're a private, nonprofit corporation. Our job is to be an advocate for people who have disabilities inside the state of Idaho. I'm not an economist. My expertise does not make me the best person to talk about the effect that this will have on Idaho's educational system, but I do have expertise in Idaho Medicaid, how Medicaid works, what it does, and how it affects people when you cut it. The amount of money that is proposed to be cut from the Medicaid budget, which is the alternative to raising some kind of tax revenue, this is one piece of the alternative to raising revenue, is to take this money out of the Medicaid budget, or at least it's seen that way. And as I talk to you later, I'm going to show you that that's actually not an alternative. But taking this money out of the budget, the amount we're going to take out changes from week to week. When the governor's proposal came out, we were talking about $25 million being taken out of the Medicaid budget in state dollars. But Medicaid is interesting because when you cut $1, let's say, whenever you cut $3 of funds, state funds out of the Medicaid program, $7 of federal funds goes away. So in order to save $3 million in Medicaid, we have to cut $10 million in services. So in order to save $25 million in Medicaid, we have to cut $86 million in services. A week ago, we were talking about cutting $50 million out of Medicaid. So to save $50 million, we have to cut hundreds of millions of dollars out of Medicaid in order to, of services in order to do that. So even more so than in education, when we try to save Medicaid dollars from our state budget, we suck a lot of money out of the state economy. But that's not the main issue that concerns me. The main issue that concerns me is what it does to the people who receive Medicaid. Idaho is not a generous Medicaid state. There has been a lot of talk about the fact that we have certain services for people with developmental disabilities that other states don't have. But you see, the point of having those services was so that we had a less expensive alternative to the other types of services like nursing homes and institutional placements. So we do have, in some ways, more options for people on Medicaid who have severe and chronic disabilities than other states have. But we didn't do that because we decided to be generous. We did that because it saves us money. Because if we didn't do that, we'd be spending much more on hospitals, on emergency rooms, on intermediate care facilities for people with developmental disabilities, and on psychiatric inpatient facilities. So our Medicaid program for people with disabilities, this array of community-based services, has all been carefully crafted over the last decade to replace expensive mandatory services with less expensive optional services. And we have done that fairly well compared to some of our neighboring states. And having done so, we've created an array of community support systems. But this cut threatens to literally destroy some of the major components of that system. One of the proposals just to meet the $25 million cut was to completely eliminate all psychosocial rehabilitation services for people with severe and persistent mental illness, and to completely eliminate all developmental therapy for people with developmental disabilities and intellectual disabilities. That would not get us our $50 million. So we're talking about something bigger than that. That wouldn't get the $35 million, which I think is where we were sitting as of yesterday. So we're still talking about something much bigger than that. These are the services. These are the services. I'm going to talk for a minute about psychosocial rehabilitation services. Psychosocial rehabilitation services allows someone who's got training and some clinical experience to go into the homes of people who have severe and persistent mental illness and make sure that their symptoms are not recurring, make sure that they have basic housing and food, make sure that they understand how to spot their symptoms, make sure that they are going to their doctor's appointments, that they have access to their medications, that they haven't lost the ability to purchase them, that they are taking their medications, and they are teaching these people the skills that they need to recognize when their symptoms are getting out of control. We have succeeded in Idaho in deinstitutionalizing people with severe and persistent mental illness and supporting them safely in the community using these services. We have no history of what happens with all of the people with severe and persistent mental illness in the community if we take that service and support away. We have no idea where that will go. But let me tell you, treating a mental illness is not just a matter of taking a medication. People don't just take their medication and then they're fine. Many of the people I'm talking about still have persistent hallucinations. Many of them still live with persistent delusions. They need a lot of support, a lot of monitoring, and a lot of help to be able to live safely in their communities. Cutting those services will almost certainly result in death for some of those people. It will result in suicide. We've already seen dramatic increases in suicide among people who have mental illness in Idaho just from the last cuts that we had in the years, last year and the year before. So we were talking about people who will die. If we eliminate community supports for people with developmental disabilities, we will take people who have with those supports moved out of institutions, moved into our communities, who may be actually training for a job. Some of them are actually employed or even self-employed, people who could never have done any of these things without the concerted, specialized type of training that they get through developmental therapy. We'll just jerk those supports out from under them and hope that everything is okay. And our experience is that when people lose those supports, everything is not okay. You'll see families torn apart. You will see people who become homeless. You will see people who will no longer be able to work, and you will see a greater demand for institutional care and for building of new group homes and intermediate care facilities. So there's a tremendous human cost in what we're talking about doing here, because after we get done with all that, we still have to find another $15 million in state funds, which is, again, almost 3 times that in total services that we're going to cut out. And that means we're going to have to be going after waiver services for people who have the most severe developmental disabilities. I can mention my son, who's 38 years old. He's a loyal Bronco fan, a lover of jazz, blues, and rock and roll, and he is about the friendliest guy you are likely to ever meet. He also has a very significant intellectual disability. He is paralyzed from the neck down due to a spinal cord injury. He needs the assistance of another person to perform any basic activity: eating, using the bathroom, getting out of bed, putting on clothes. He has 4 health conditions which require constant monitoring and occasional trips to the emergency room. Any one of these health conditions, if not detected and treated, could lead to death in as little as an hour. So we're talking about a person who needs assistance 24 hours a day, 365 days a year. If we go in and we cut these waiver services, we're talking about taking away that one-to-one assistance that people like my son get. It's expensive, but it's still less than half the cost of Idaho State School and Hospital on a per-patient basis. It's far less than the cost of a long-term acute care hospital, which is what my son would qualify for, which is probably $1,000 per person per day. So there's a false sense of savings. Taking these services away and cutting them out of the budget doesn't save you money if those people wind up in a more expensive service that you aren't allowed to cut because it's a mandatory service. No savings occurs in that case. But it's worse than that. Okay? It's actually worse than that. Because in pure economics, even if we assume that none of these people actually experience any of these hardships and that none of them go to higher cost services, the economic impact of pulling out Medicaid dollars winds up reducing your revenue stream by almost the same amount. How does that happen? Well, first of all, you take $10 million out of the state Medicaid fund, we lose $23 million in federal funds. Where does that $33 million go now? Well, that $33 million goes to pay for Medicaid services, extremely labor-intensive services. Almost all of it is paying the wages of some hard-working Idaho taxpayer. Okay? The very people that I sometimes have heard legislators say they're trying to defend the taxpayers against the possibility of a penny of sales tax. Well, these are hard-working taxpayers. They've got a job. They go to it every day. And that's where this Medicaid money goes. It gives them their jobs. If you cut $50 million out of the state budget, you lose 4,000 jobs. If you cut $35 million out of the state budget, you lose 2,800 jobs right off the top. What does that do to your revenue stream? Well, not only do those people make money and pay taxes on the money that they're given, that they earn through Medicaid services, those people also buy services and they buy products, and that gets taxed. And when they buy those products, they buy them from merchants who hire people who in turn pay wages, and those people pay taxes. This is called the multiplier effect. And in a Medicaid multiplier effect, for every $10 million in state Medicaid dollars, you put about $41 million into the economy, and you generate revenue of about $10 million. Okay, just threw a bunch of numbers out there, but the final equation, for every $10 million of state funds you take out of Medicaid, you lose $10 million in state revenues. Okay? Where's the point in that? We can cause a lot of suffering, we can cause a number of deaths, and we can dismantle what has been a pretty decent system of community supports for people with disabilities to save $0 in state revenues. Okay? So this does not make any sense. And that is the reason that it's very important for people to open their minds and start to think about revenue as the only reasonable way to solve this problem. Because when they make up those budgets in the Joint Finance and Appropriations Committee, they take $10 million out of Medicaid and they think they've saved $10 million. And the bill comes out and says we saved $10 million, but it says nothing about the fact that we also lost $10 million in revenue. The next problem is we haven't even looked at the fact that not all of that money gets saved. Much of it, most of it, probably all of it goes to pay for higher cost services that the people who lost those services now go to in order to try to get by and try to survive. Some of those services don't even get federal match. So for example, when we take psychosocial rehabilitation services away from people with mental illness, if they wind up in the state psychiatric hospital, there's no federal money for that. So we were paying a very low-cost service to keep people in the community. They moved to a much higher cost service that is 100% state-funded service. Okay? This is not a solution to balancing the budget. It may balance the budget on paper when you write it up, but it doesn't actually balance the budget. It creates a spiral. So we cut jobs, we eliminate the Medicaid multiplier, we reduce our revenue, we have saved no money, but we have put the economy further into a tailspin. So these Medicaid cuts that are being proposed are a recipe for a constant downward spiral that doesn't help our state system and hurts a whole lot of people. Thank you for the opportunity to be able to say that.